how far you will be able to use for cosmetology and aesthetic for the dentistry in using the CT or radiology?
Doc, our branch epitomizes the ethic of teamwork. I don't think I can do any of what I do alone. And I have no two thoughts about it. It is a teamwork. And one of the important pillars happens to be diagnosis and radiology. Now, just like Dr. Savina said, surgery a lot of times is inevitable, whereas cosmetic is optional. So it's extremely important that you put the story across to the patient, understand what their needs are, what their expectations are. Then you kind of need to moderate it down, okay? Because however good a dentist you and I are, we will not be able to meet all their expectations almost most of the time, okay? So you kind of need to moderate it down to what is realistically possible. Secondly, it is our duty, because the patient trusts that we know better. We have to be able to make them understand what is really good for them. So sometimes something that they're asking for may not in the long term actually be good for them. So it's extremely important to put those drawbacks down to them and explain to them how a middle ground would be better, or how they can look at an alternative option or drop the procedure entirely. I'm not just talking about fillers or derma fillers or those kind of things. Even when we're doing veneers or crowns, a lot of times, at the cost of losing what we call business, I have to advise the patient that this isn't the right way for you to go. Yes, you're looking for quick treatment. Yes, you're looking at overnight transformation, but there is a slower way to do it. There is nature's pace at which you can go and get long-lasting effects, results. And our primary duty is always to preserve what nature has given, enhance what nature has given, and only then bring in anything artificial that we would. I think that is the core ethic. So here, diagnosis plays a large role in educating the patient. One is for me to just talk to you, doc, but if I can show them x-rays, if I can show them documentation, visually make them understand where they are, why we are doing what we are doing, and how we are going to reach there. So I take a lot of help, and like the other panelists were saying, cone beam CT has kind of become an inevitable part of our diagnosis. And I'm glad in a city like Bangalore, it's easily accessible also. We have to keep that in mind, because a lot of times when it is the second tier cities, we may not have access to CBCT. So I kind of rely on traditional wisdom of IOPAs and OPGs, which I still feel is a very, very useful diagnostic tool for us.
Okay, so now in your practice for cosmetology and aesthetic dentistry, how much of oral medicine department as a per se it will help you?
Let me put it this way. Anything that I have to do, even if it is to do a filling, my first instinct is to diagnose, right? So I am going to be using all my oral medicine skills, my ability to diagnose, my ability to ask questions and get to the root cause. So for example, simple things like we talk about erosion or there is discoloration in the tooth. It's very easy to just go and, plate some filling over it. But I would rather look at a detailed history, look at your medical background, look for any gastrointestinal symptoms, look for urethritis, look for any underlying conditions. So, I would say as a student, we paid a lot of attention to oral medicine because my principal was a professor of oral medicine. So, we had a gun to our head and we had to listen. But I'm so glad we did, because today I find that the diagnostic skills are almost the most important tool when we have to begin treatment. And when you're talking about comprehensive treatment, doc, even if we've missed out on one particular crucial information related to the general health of the patient, you could actually end up in destroying your final result. Okay, the kind of medications they're on, the kind of allergies that they may be having, any other reason why the tooth is, behaving the way it does, or if the structure of the tooth itself is looking weak. I always fall back on my physicians. I like how he used the word oral physicians. Henceforth, I'm going to call my colleagues oral physicians. I thank you so much for that word. I really like it. I think it adds a lot of weightage to what we do. Yes, so there's a lot of back and forth that happens. And sometimes IOPs are misleading, and it never hurts to get another set of eyes to take a look at it. My oral physicians are just a phone call away. So I have no ego whatsoever to accept that I'll take all the help that I can get, whoever it may be.